Welcome to our lecture on measuring BMI and understanding its significance along with precautions. Let's dive right in. To begin, let's understand how BMI is calculated. BMI, or body mass index, is calculated using a simple formula, dividing your weight in kilograms by the square of your height in meters. Or, if you're more comfortable with pounds and inches, you can use an alternative formula and then multiply by 703. Once you've calculated your BMI, it falls into one of several categories: underweight, normal weight, overweight, or obese. Each category represents different levels of health risks associated with weight. Now, let's explore the practical uses of BMI. Firstly, it serves as a screening tool for health risks. By assessing your BMI, you can identify potential weight-related issues and take proactive measures to address them. Additionally, BMI is valuable for monitoring weight management progress over time. However, it's important to acknowledge the limitations and precautions associated with BMI. BMI doesn't differentiate between fat and muscle mass, and it doesn't consider factors like body composition, ethnicity, or age. Athletes and individuals with higher muscle mass may have elevated BMIs without necessarily facing health risks. Therefore, it's crucial to consult with a healthcare professional for personalized advice and interpretation. In conclusion, BMI serves as a valuable initial assessment tool for weight-related health risks. Understanding its limitations is essential for accurate interpretation and decision-making. When used in conjunction with other health indicators, BMI can guide lifestyle changes for better health outcomes. Thank you for joining us for this lecture on BMI. Stay tuned for more informative content.